We are here at Wilkins Hospital in Harare, where we are tracking the trends that have been occurring in the country over the past week, particularly looking at the COVID-19 figures, which are recorded a spike during the past week. And this has been attributed to a number of factors. The president actually flagging the Easter holidays as one of the pushing factors that led to that spike in terms of the COVID-19 infections. But just to get a feel of how the trends are now and the final details regards how government continues to strengthen the programs around circumventing the challenges presented by the COVID pandemic, I am joined by the National Coordinator for the COVID-19 response in the Office of the President and Cabinet, Dr. Agnes Mahomva. Good morning, Doc.
Good morning, Theo. How are you?
Very well, thank you. And let's have our point of departure on the trends that were recorded over the past week. This was quite some scary figures, and now the figures are coming down. What can we say about the trend that we witnessed last week?
Thank you for asking that. A lot of people were very concerned and really asking so many questions about those numbers. But we say let's not panic. We are so very aware of the numbers that went up the second half of last week, and quite clearly we jumped on our numbers, analyzed and tried to figure out what was going on. And I'm delighted to let you know that a large bulk of them were actually coming from an outbreak in one primary school in Matebeleland South, Umzingwane district specifically. And the teams on the ground, Ministry of Health and Childcare, jumped on it to do the appropriate investigations that we have always talked about, guided by the guidelines and SOPs that we put in place last year when we had similar outbreaks in schools. So we're very glad that our teams were very prepared and jumped on it. And as we're speaking, they have wrapped up the investigations. They are busy implementing the recommendations from those investigations. And you saw yesterday the numbers are down. Only 15 recorded with no deaths nationally. So we're very happy and we feel very confident that that outbreak is under control and we're back on track. Of course, we'll continue watching our numbers because you never know what happens, especially and rightfully, as the president said, we're coming out of Easter. There were some gatherings here and there. So we want to keep a very close eye on our numbers, continue analyzing so that we jump on them and do the necessary and so on. This is one of the reasons we're so proud of our surveillance system. We have strengthened it and it is actually yielding results. The whole idea of a surveillance system is for us to be able to identify cases early, investigate them early, and manage them early so that we don't have any spread. So we're very confident things are under control.
All right. Now, Doc, we are going into the winter season, and obviously there are a lot of colds and flu that come out along with the winter season. Now, is there a reason for Zimbabwe to be fearing this season, seeing that this is also the time that we recorded a peak in terms of the COVID statistics last year?
Well, I always say no reason to panic, but we just have to be vigilant. This is the time to buckle up and make sure we really strengthen everything we're doing. And when we say strengthen our response, we're not just talking of government, we're talking of you and I as individuals. Are you masking up? Are you washing your hands? Are you social distancing? Are you avoiding those crowds? That is being vigilant, and that's what we're really pushing for as we're getting into the cold season. If we manage to continue doing that, and of course, to add on the second preventative measure that we've introduced, make sure you're vaccinated. That's what we're saying. And I am very confident, once again, the country is on track. We will have spikes here and there. That's normally any outbreak in any epidemic, in any pandemic. That is normal. The key is to remain focused, look at our data, analyze it, and jump on it with implementation responses to any issues, any challenges that would have been identified by those investigations.
And Doc, obviously, with a lot of coordination that has been ongoing, obviously with a number of holidays lined up as we go into the year, how are you going to be ensuring that the events that were recorded during the Easter holiday are not repeated so that the country is not exposed?
It's the same message. Our message is so simple and clear. First of all, there's what the communities, you and I, need to do. And we'll continue emphasizing that, really washing our hands with soap and water, avoiding those gatherings, you name it. But we also go to the public health measures that the Ministry of Health and Childcare leads. in terms of our surveillance, testing as much as we can, contact tracing, you name it. And if there is any outbreak, whether it's in a school, whether it's in an organization, jump on it immediately, investigate, quickly put in place measures that control it, address whatever challenges that would have been identified, enhance control, make sure that there is no spread of the infection outside that small area where you would have identified an outbreak, for example.
All right. Well, thank you so much, Dr. Mahomva, for giving us that brief in terms of how you are ensuring that you take every measure and precaution to combat the COVID-19 pandemic. Well, there I was talking to Dr. Agnes Mahomva. She is the National Coordinator for the COVID-19 response in the Office of the President and Cabinet. And there she was outlining the various response strategies that the country has actually embarked on just to ensure that this COVID-19 pandemic is reined in. Now, remember, the President is also on point, stating that social gatherings are strictly forbidden, even encouraging the nation to stay away from large gatherings, which may act as super spreaders for the COVID-19 virus. So from here, we will be exploring more in terms of what the country is doing to circumvent the challenges that are presented by the pandemic. Otherwise,